that will occur related to those new prisons that we're going to build and the safety that's there for not only our inmates but also for our corrections officers. We're going to solve a problem that's been facing our state for many, many years. And if we solve this, we will go from the worst in the country to the best, and that's our goal. And I want to thank our Commissioner of Corrections, Jeff Dunn, who has done a fantastic job. He came up with this idea working with me, and we passed it through the Senate last night, and I want to thank all the senators who helped us with that last night. The one who carried the bill, Senator Tripp Pittman. I also want to thank Senator Slade Blackwell, who helped with all the amendments that we've worked on to get the bill in the right position. And also I'd like to thank Senator Smitherman. He also came with a very good bill dealing on racial diversity as far as the hiring of individuals to help build these. So it passed a big hurdle last night. We've got one more hurdle. But this is some good news, and I wanted to bring some good news. And now this afternoon, we're talking about another issue. This is not quite as good news as we have with the prison system. You know, for a number of years, we have tried to make our Medicaid agency more effective, more streamlined, more efficient, and we have tried to improve the lives of the people of this state, the 1 million people in this state who depend on Medicaid. And we did that. The legislature and I signed legislation to create a model that I think is a model for the rest of the country. The RCO programs, the regional care organizations, which goes from a fee-for-service type system to a performance-based outcome type system and a managed care system. We did this hoping that we would be able to obtain some money from the federal government, and we applied for a 1115 waiver. We worked 2 years on that because of the regional care organization plan that we'd put in place. And because of that, we have been awarded $747 million. Now, the budget that was passed by the legislature that I vetoed, and that veto was overridden by the legislature. This budget cuts what we think is the minimal amount of money that we need to adequately run the Medicaid system, to institute our regional care organizations, and to be able to keep our $747 million of the 1115 waiver. We're $85 million short. It is what it is. The budget has been passed. I vetoed it. The budget, my veto was overridden. So that budget is now in place. So that's what we have to deal with right now. Now today we're here, and I'm going to ask in just a second Stephanie Azar, who is our Commissioner for Medicaid. She is going to present to us some possible cuts that we may have to do in order to live within our means of the $700 million that has been given to us by the state legislature. Now, this is not adequate, and we know it's not adequate. And we will be looking first at whether or not we can live within our means, whether we can still keep our RCOs, which we may not be able to, whether or not we will be able to keep our 1115 waiver, because we may not be able to. We cannot take the money from the federal government if we can't pay it back. So we're going to have to make some very tough decisions. We also, after looking at all of the options that will be given to me, after we look at those options, then what we will do is make some very tough decisions. The people of Alabama have real problems. Our healthcare system is in trouble. Our hospitals are in trouble. The rural doctors that work in the areas of the state that really have the most need, they're in trouble. So if we cannot adequately fund the Medicaid system that we have in the present time, which is the underpinnings really of our entire health care system in the state of Alabama, and it is in most states, but certainly in Alabama it is, that we're going to have to make some very tough decisions if we do not get more revenue. If we have to live within our means, we're going to have to make some very tough decisions. And so I'm going to ask Stephanie Azar to come and present to you some of the options that we will be looking at over the next few weeks. So Stephanie, thank you.
Thank you, Governor. Good afternoon, everyone. As you know, everyone knows today that we have an approved budget for Medicaid at $700 million, which is $85 million short for what we need to sustain our current system and move forward with RCO transformation. I have provided the governor, we have met several times, and I have gone over with him a list of possible options that would result with the cuts that we can possibly make. I think today it's very important for recipients to know that their access to care is at risk, and for the Medicaid providers in this state to start preparing for the impact of these cuts. Because as we stated, this is now the budget for Medicaid at this point in time. I'm going to go through this list of options that I've given to the governor to each of you today so that we can make aware of what we're looking at. And many of you have heard these options previously that I have discussed about the potential impact of a budget like this could have on our program. Please be aware that these cuts do have to come with CMS approval, and that we've done our best estimates of how much these cuts would generate in savings to the state. The possible programs that are up for possibly being cut, we would have to eliminate adult eyeglasses for adults, and I'm going to mention the amount of money that we could potentially save in state dollars. I'm not going to talk about total dollars at this point. We'll talk about what the impact is for the state. Elimination of eyeglasses for adults would save $300,000 for the state of Alabama. We'd have to eliminate outpatient dialysis, which would save $3.7 million for the state of Alabama. Eliminate prosthetics and orthotics, which would save approximately $500,000 for the state of Alabama. Eliminate the program of all-inclusive care for the elderly, which most of you will better know as the PACE program. That is an important program in the Mobile area. That would save the state $2 million. Eliminate the health home and the physician case management fee that goes along with that program. And the health home program is the foundation for our RCO implementation. That elimination would save $16.6 million state dollars. We also would be required and possibly have to eliminate the physician primary care bump, which allowed our physicians in the state of Alabama to be paid at the Medicare rate. That would have to be eliminated. That would save the state $14.7 million. The agency also is looking at a reduction in our administrative costs internally at the state. That could potentially save $3.5 million in state dollars. Also, we are now having to look, as we said, since this budget became a reality yesterday, at looking at eliminating our drug coverage for our adults on our Medicaid program. We still would be required to cover drug coverage for children, but we would not have to cover it for the adults on our program. We estimate this to be 50 to 60 million potential state savings. That is one of our largest potential cuts that we could make for impact to fill this $85 million shortfall that we have. We also have the option of implementing a pharmacy preferred provider program. We estimate that range to be potentially between 19 and 30 million state dollars. The governor will have the choice in front of him where he could maybe choose to eliminate drug coverage for adults and not implement a preferred pharmacy provider, or he could do the pharmacy preferred provider and not eliminate drug coverage, or he could do both. You could eliminate drug coverage for adults and put the children into a preferred pharmacy provider. We also, as many of you have heard me state several times over the last few months, we would have to implement reimbursement rate reductions to our providers, which means we'd cut the reimbursement rate. Who would that mean? It would be providers such as ambulatory surgical centers, an additional cut to all of our physicians because they will have lost the primary care bump, cutting dental, optometry, hearing, transportation, EPSDT screening, that is services for our children, health education, maternity, family planning program, and others. We estimate this to be in a range of 0 to 50 million state dollars, and I say 0 to 50 million because it depends on what options we have available to us. A combination of these options could be chosen by the governor. So that's where we're at with that list of options that I have shared with the governor. And none of us want to be standing here having to talk about any of these. It is the governor's goal and it is Medicaid's goal that we do everything possible to continue our RCO implementation. That approval of that 1115 waiver was a major milestone for the state of Alabama, and the state of Alabama should be very proud of that. And the nation is watching us very closely on how we have the potential to implement and affect great change in the healthcare system in the fine state of Alabama. However, if there is no additional funding, and as of right now there isn't, Medicaid will not be able to move forward with the RCO program. The state of Alabama will lose the opportunity to receive an additional $747 million over a 5-year period coming into our state's economy. And also, and maybe even more importantly, we will lose the opportunity to increase quality and efficiency of care for our citizens and to slow the growth of the Medicaid program in the out years. Any combination of these cuts to our program are real and meaningful cuts, and none of us want to have to implement these cuts. But it is important today that we make sure everyone is aware of what the potential impact will be. Thank you. I'll turn it over to the Governor.
Thank you.
Thank you.
All right, I'm going to set some ground rules before we get started with the questions. We're going to talk about Medicaid and we're going to talk about prisons, and that's all we're going to talk about. So I'm telling you right now, do not ask me anything other than those two things. So I'm setting the ground rules. Let me say this also. This state has some real problems, and we're here to try to solve those problems. We have been elected by the people of Alabama to try to solve those problems because we have people in Alabama that are hurting. And our job is to try to help the people of this state, and that's why we're here. And we're going to continue to do that. These two issues that we've talked about today will improve the lives of people across this state. The Medicaid problem that we're talking about today, there are going to be people suffering because of what we're going to have to do if we have to implement some of these cuts. So I will offer it up now for questions. We have not made a decision on that. That will be something that we will look at. We will wait until we weigh all of this and make a decision on whether or not we're going to implement some of these cuts and whether or not we could still retain our RCOs and the 1115 waiver. But it looks like we cannot, but we will look at that. We have not made a final decision on that. I did say that. I am backing off that a little bit because I actually have a budget now. And I've got to work with that budget. And it is the law, and we will do that. But here again, we will make that final decision down the road in a few weeks.
CMS, to answer your first question, yes, I have had conversations with CMS. To be quite honestly, they check in with me very regularly. They're very in tune to the media attention as to regards to our budget. There is not a timeline. There's a process that we're working through here with the budget, and they will look for me to turn to them as to what I'm funded with and what we have to do. Because as I said, many of these cuts have to be implemented through changes to our state plan with CMS, so they're going to know the moment that I have to start doing these cuts to live within that $700 million budget. It is going to be at that point in time, I would guesstimate, that the conversations will start talking about whether or not they would continue to support our RCO program. They have checked in just to basically see where we're at with the budget. At the time, I told them we did not have a budget the last time I spoke to them because we did not. I shared with them the gloom outlook in regards to that. Their comment was that they would continue to check in with me and see where we are, and that's basically where we were on that.
My reaction is we're already doing that. We're going to do it with the programs that we've put into place. I don't think that he wants to see the women in Tutwiler have to be in a place that they have been in over the last number of years. We want to build prisons so that inmates, they're being punished by being taken away from society, but they need to be kept safe. Whether they're men or women, they need to be kept safe, and that's exactly what we're going to. We want to train people while they're in prison, those who are going to get out. We want to train them so that they can get out and get a good job, and so that they can have a different life, so that they can contribute to society. So, and that's our goal. Well, we have to, in order to save enough money to pay for the prisons, we have to build, with a design-build program, we have to build the 3 men prisons, or we will not be able to save $50 million a year, and we will not be able to float the bond issue. So that's why we're doing it the way we're doing it. Yes. Yes. Well, a change in heart and a change in attitude of whether or not we need to adequately fund the essential services of government for the state of Alabama. And we will work on that. It's going to take the attitude that we truly must fund this program because we have 1 million people in this state on this program, and not only 1 million people on this program. It is the underpinning of all of our health care programs, and it creates problems for our primary care doctors. It creates problems for other patients, not only on Medicaid, but if we have to see a lot of these patients and they don't have adequate payment to the hospitals or they don't have any insurance, you know, we all pick up that bill. It affects all of us. So I think it's going to take a change in attitude and a change in heart is what it's going to take. Well, you know, I led them through a year last year of ways that we could adequately do this, and we said if we don't do it last year, which we did not, we're going to be back in the same position that we are this year. Now, if we don't adequately fund it this year and have some backup system to adequately fund the general fund, we're going to be back in the same system next year. We're going to be back in the same problem next year. I have not made that decision yet. I will begin to study all of those, and we will look at the ramifications of those cuts. We want to do the cuts that, I mean, they're all going to have dramatic results, I mean, bad results for the people that are involved. But we'll make that decision over the next few weeks. Well, to be honest with you, we have trouble funding any system, and it's obvious right now. So we will look at all systems, but that probably will not get preference over some of the other things. So, but we'll look at everything. I have some ideas, yes, but if the legislature is not interested in doing those, they're the one that they have to present me with the amount of money, and they allocate, and I carry out the executive part of government, which is to make sure that what we have works, and so that's what I'm going to have to do. Yeah. Well, I mean, yes, you know, the budget that we sent over this year. The budget that we sent over was to unearmark 2 funds. It was to unearmark the rest of the part dealing with the insurance premium tax, and also the rest of the use tax, which is 47% that has not been on earmarked. That was $181 million. That would be brought over. And then we hope that they would backfill that with something so that education would not be out any money. No. Yes, ma'am. Mary? Well, when we institute a new program like this, we have to front-end load some of this. And that's basically what we're having to do to get the RCO programs up and running. Now, our goal eventually with the regional care organizations is to bend the cost curve. Now, do we think that long-term this is going to actually lower tremendously the cost of health care? No. But if we can bend the cost curve, and that's what we're really trying to do, so that we can slow down this increase that is happening all over the country. And that's our goal. And I think that is what CMS is looking at. Because, you know, states are laboratories for change and laboratories for ideas. And this is a new idea. This particular type program has not been instituted anywhere else in the country. There have been some other managed care programs, but not one like this. And so we've got to prove, and in fact, in order to keep the $747 million, we're going to have to pay some of that back if we don't bend the cost curve, if we don't have some cost savings in there, but we believe that we can. Pardon? No, we never have said that an exact amount. We don't know yet what the savings are going to be, but we do believe that we will bend the cost curve so that we will have savings. All right, thank y'all very much.